auto and ankle rolls. First is inability to bear weight for 4 steps immediately after the injury or at the hospital. Second sign is tenderness at the distal 6 centimeters of the tibia and fibula, or right before the medial malleolus, at the other posterior end. So, let's palpate. Is that tender?
No.
Okay. Then go ahead and flip over. So you're lying on your back. And then third is tenderness at the navicular, or at the base of the 5th metatarsal. So just, is that tender?
No.
Alright, good. Test time cluster of the subacromial impingement and rotator cuff tear. In the rotator cuff tear, there would be the painful arc sign, so this scapular plane, and the drop arm sign, and infraspinatus muscle test, positive. And then in a subacromial impingement, it would be the same thing, except instead of the drop arm sign, there would be the Hawkins-Kennedy. So. Spinal manipulation. One is it is acute injury less than or equal to 16 days. The FABQ participation scale is less than or equal to 18 points. At least one hypomobile segment. There's no pain distal to the knee. And at least one hip has an internal rotation greater than or equal to 35 degrees. So, relax. And this would be greater than or equal to 35 degrees. Okay. Test item cluster for spinal stabilization. Patient would have aberrant movement. They'd be less than or equal to 40 years old. And go ahead, lie down. Average straight leg raise of greater than or equal to 9 degrees on both legs. And then go ahead and stand up for me. And positive prone instability test. So you're just going to go flex, hold on, and I'm just going to go ahead and palpate first. And if you have a painful segment, then go ahead and raise your legs. And the pain would disappear at a positive test. Go ahead, right up. Thanks. Test item cluster for cervical radiculopathy. Positive Sperling's test. A positive distraction test. Less than 60 degrees of ipsilateral cervical rotation. So go ahead and look over your shoulder. Measure that. And then a positive upper limb tension test, part A. Upper limb tension test A. So lay down. Let me know when it hurts, okay? Put your head straight. Oh, it hurts. A test time cluster for neck pain that can be helped with thoracic manipulation. 1, the injury is an acute injury less than 30 days. The FABQ physical activity scale is less than 12. Pain is not aggravated by looking up. And cervical extension is limited to less than 30 degrees. So go ahead and look up. Does that hurt?
No.
No? And you can go out of measure. You can look back down now. There's no pain distal to the shoulders. The upper T-spine kyphosis is diminished. Number 7, the Thessaly test in order to test for meniscal pathology. So I'm going to want you to hold on to this just in case you lose balance, but don't really depend on it. You're going to put one leg up. Now the leg you're standing on, bend down to about 30 degrees, and rotate. Alright, lost balance. Now let's do on the other leg. Okay, same thing, bend to 30, now go rotate. Okay, 3 times on each, no pain. ACL incompetency in the knee. I'm going to do the anterior drawer test. So, and upper limb tension test A. So, lay down. Let me know when it hurts, okay? Put your head straight. Oh, it hurts. So go ahead and look down. Lower pressure, no pain. Tell me the truth, okay? Let me know when there's pain. Pain? Now look up. Make the pain go away?
Oh, yeah.
Alright. Well, the Scour test. If that will be flex your knee. Okay. Any pain?
Nope.
No pain?
Nope.
Good. 14, the distractional compression test. Okay. Any pain there?
Nope.
Any pain there?
Nope.
Okay, good. 13, the Taylor tilt test. So, let me know if there's any pain. No pain?
Nope.
Okay. Faber exam. Any pain?
No.
Any pain?
No.
Differential diagnosis between a C5 radiculopathy and a rotator cuff tear. So in a C5 radiculopathy, I'd expect to see some dermatomal pattern. So there would be numbness and tingling in this pattern, or there would be radiating pain. So right here. Okay, left one please. And then the myotomes would also be affected. For example, the deltoids and the biceps. Okay. Finally, there would be hyperreflexia in the biceps reflex. Okay. On the other hand, a rotator cuff tear is a musculoskeletal problem, so there wouldn't be any sensation loss, and the testine cluster would be positive for that, which is in a previous video.
The test. Okay, but we understand what's going on, right? Okay. Alright. Before I do that part, Papa, you're going to be lying down. Lie down now. Here. Okay. I'm going to be like, does this hurt? Does this hurt? This is going to be right here. You're going to be like, yeah, this hurts. And then that's the same spot I'm going to touch over there. I'm going to be like, is this the part that hurt? You're like, yeah. And then
See the half